Hello and welcome to our sharp safety training where we will be covering awareness and safe use. And so our learning outcomes for this session, one, to understand what is a medical sharp or simply sharp for short, and the difference between non-safe and safe sharps used in healthcare, to understand the risk of infection from biological agents caused by sharps injuries and other forms of exposure such as splashes, to be aware of the legal requirements and the standards to effectively manage sharps risks in healthcare work, to understand the importance of a sharps risk assessment, where to find it, and the hierarchy of controls for managing sharps, including safe working procedures, to understand what to do in the event of a sharp spillage or injury and the importance of reporting and investigating all such incidents. And if you're a sharps user, to become familiar with and understand how to correctly activate specific safety devices commonly used across our trust. So we will begin module 1, introduction, types of sharps. So what are sharps? Well, this training focuses only on the risks associated with what we call medical sharps. And so in simple terms, a medical sharp or medical sharps are only those objects or instruments necessary for carrying out a specific healthcare work, but could cause injury by cutting or pricking the skin. The key element here is necessary for carrying out specific healthcare work. And so ordinary hazards such as broken drinks bottle or construction nails, etc., do not fall under the above definition and therefore not covered by this training. Medical sharps can further be categorized as either non-safe sharps or safe sharps based on their design. So, what is a non-safe sharp? Well, in simple terms, a non-safe sharp is a sharp that has no mechanism to prevent or minimize the risk of accidental injury. And below are some common examples that you would find across our trust that are considered non-safe sharps. So here we have a traditional non-safe scalpel blade. Now the blades can be taken on and can be put on and be taken off, but there's no protective mechanism during use or after use. Similarly, we've got traditional non-safe hypodermic needle where there is no protective mechanism after use. So the tips continue to be exposed even after they are used. Here we have, again, traditional non-safe butterfly needles. The tips have no protection after use. And again, traditional non-safe IV cannulas, where the tips have no protection after use. Now, these are winged cannulas. So you can see here, these are the wings. We also have what we call non-winged cannulas. So the wings or the non-wing element of the cannula doesn't determine whether it's safe or not. It's really the mechanism, the tips, which we will see when we go to the safer alternatives. And then here we have a traditional non-safe insulin needle where the tip again has no protective mechanism after use. And I just also want to highlight again these caps which we remove to use the needle. They are not considered safety devices, and therefore recapping generally is prohibited unless there is an absolute necessity within the procedure. And again, we will talk about that later on. So conversely, a safer sharp is one that incorporates a mechanism or designed to prevent or minimize the risk of accidental injury. And so if we take the examples of non-safe sharps, here are some safer alternatives that you would see within the trust. So here's an example of a safety scalpel. The safety mechanism here is the slider mechanism, which will help to retract the blade during or after use, which then prevents the needle from being exposed. Here we have a safety hypodermic needle, and so here we have a cover After use, the cover is activated by flipping it with our thumb, generally, or against a hard surface. The cover then covers the needle, and then what you would normally hear is a click that tells you that that cover is now secure. And so the needle is now protected. Now, there are different versions of these sorts of hypodermic needle that we use in the trust, but the principle remains the same. It has a cover, it has a clipping mechanism to make sure that you are that you can confirm that the device has been engaged. Here we have a safety butterfly needle, and so what we have here is a shield. Once the needle is used, you use your thumb to move the shield forward or to push the shield forward. That then covers the needle after use. Now, this version is to be used with a vacutainer. You know that by seeing this little end here, but you can also find versions that you can use with a syringe as well. But the important bit is the safety mechanism. So butterfly, the winged cannula, which we talked about earlier, we can have non-winged versions of these as well. So the safety mechanism here, once the cannula has been inserted, you remove the guide needle, and as you remove the guide needle, it activates a safety tip. So it covers the end of the needle. So once fully retracted, the end of the needle is covered, and then you dispose of it as per normal. And then finally, you have an example of a safety insulin syringe. And so what this one has is a arm at the side. Once the needle is used, you use your thumb to slide the arm forward or upward, and then you're left with something like this, where the tip of the needle again is covered. So all of these demonstrate specifically engineered elements to make sure that they are safe after use. So the key message here is that if you are a sharps user, you must know what type of device you are using and why, and you must always use a safer sharp where available as your first option, unless there's a clear documented overriding risk why this is not possible. So we then move on to the risks associated with sharps. So why do we need to manage sharps? Well, potentially there are over 20 types of diseases that could be transmitted as a result of sharps injuries. The key one, the ones that are always in the headline, is hepatitis B, hepatitis C, and HIV. And of course, these can lead to serious complications. Now, this is also issue not just in the UK but across the globe, and so everywhere action is being taken to understand and to reduce the risks around sharps, because ultimately the risk of injury can cause stress and worry and can really affect families and lives, particularly for people who receive sharps injuries where the source patient was positive for one of these diseases. So what are the key risks? We talked about hepatitis B, hepatitis C, HIV. So in terms of HIV, 1 in 300, the risk is 1 in 300 could be affected if they sustain an injury with from an HIV positive patient. Now, there is no vaccination for HIV. There is post-exposure prophylaxis, which must be taken within a certain time period for its effectiveness. Then we have 1 in 30 for hepatitis C. Again, no vaccination. It's available. There is treatment, but again, there is complications with hepatitis C. And then 1 in 3 when the source patient is infected with hepatitis B. So there is vaccination for hepatitis B, but not everybody is guaranteed immunity. And again, if gone untreated, can lead to serious complications. So who is at risk? Well, of course, yourselves, and that's why you are completing this training. But specifically any healthcare worker or student who uses sharps or system procedures involving sharps. So you may not be a sharp user, but you may assist. That puts you at risk. Staff and patients in close proximity to where sharps are being used on a regular basis. So there may be sharps, if not dealt with properly around your area, you could be exposed. So you must be aware of the risks. Staff, especially those like domestics and others who may be affected by poor disposal of sharps. So cleaners, you know, dealing with bins, if sharps are not put into the right area, they could be exposed. And then, of course, particular high-risk areas will include areas like sexual health, where we have patients who carry bloodborne viruses, areas where there's a high volume of sharps being used, so areas like theatre, those areas where there's a high footfall of patients, example A&E, and then areas where you have patients who may react negatively to sharps or move unexpectedly, example, you know, areas where there are children, elderly patients, or mental health patients or users. So these are the risks. Now, when we talk about exposure to these types of risks, this training specifically covers sharps, but there are 3 types of events that may lead to exposure to a biological agent. Sharps, of course, that we talked about. So this is when a needle or a sharp instrument accidentally penetrates the skin. And that's really important. It must penetrate the skin in order for us to consider it as a sharps injury. And this is called a percutaneous injury. You also have hard or compact tissue injury. This is when human tissue or hard human tissue, example bone or teeth, penetrates the skin. So you might get a bite from a patient, and this is also considered to be a percutaneous injury. And then you also have splash injuries. So this is when blood or bodily fluids splash into the eyes, nose, and mouth, collectively known as your mucous membranes. Or if it goes onto broken skin, the exposure is termed as mucocutaneous. So these are the risks. So how do we then address the risks? So module 3, standards for managing sharps risks. Now, as I said, there are national standards that across various countries that they apply to managing risk. Now, us, UK specifically, legislation and guidance include the following. So in summary, you have the Health and Safety at Work Act 1974, which is about safe working equipment, the general environment, procedures, instruction and training, etc., but also duties for you as an employee, what you must do in order to protect yourself and others, essentially cooperating with the arrangements in place for safety. Then you have the Management of Health and Safety at Work regulation. This is about identifying, assessing and controlling risks. You've got the Control of Substances Hazardous to Health regulation. COSH, this is about preventing harm from hazardous substance, which includes biological agents. Then you have Reporting of Injuries, Diseases and Dangerous Occurrences regulation, and this is about reporting specific incidences to the Health and Safety Executive. The Health and Safety First Aid regulation, this is about making sure we provide first aid in general and for sharps, and making sure that incidents are reported. We have PPE or personal protective equipment regulation. This is about providing PPE free of charge for staff to minimize risk. And then we have the safety representative and safety committees regulation, which is about consulting employees about the risks that they may potentially be exposed to. And then we have the big one, which is the one that is most focused on sharps, which is the Health and Safety Sharps Instrument in Healthcare Regulations 2013. And what this really does, is draw on all the other legislation that we've already talked about, and provide specific details on requirements that must be taken by healthcare's employers and their contractors specific to shops. In particular, it talks about how we manage risk, and we must manage it using the hierarchy of controls. And then you have clinical guidelines. The most common one is the NICE clinical guideline 139, which talks about infection control, and there is elements specific to how we manage sharps in the healthcare environment. So we talked about the regulations focusing on managing risk and the use of the hierarchy of control. So what does this really mean? Well, in the hierarchy of control, it means about taking the most effective action as your top priority and the least effective action as you go down the hierarchy. And so in terms of sharps, and any types of risk, you will use the hierarchy. You must avoid altogether if you can. So in regards to sharps, you may want to eliminate the need for certain types of treatments, or certain procedures that involve sharps, or substituted with procedures that doesn't involve, or equipment that doesn't involve sharps. Now, we know that that's not always possible. So the next part of the hierarchy is about engineering control. So the first one is elimination substitution. The next bit of the hierarchy is about engineering controls. So this is about, in regards to sharps, replacing traditional non-safe sharps, so sharps that we consider to be non-safe, as we gave examples of, with their safer alternatives, if we also gave alternatives. So we avoid using non-safe sharps by providing safer alternatives that have been engineered specifically for safety. Now, there may be reasons why some of these devices, why we can't replace traditional non-safe sharps with safer alternatives, so we may have to continue using non-safe devices in certain instances. So the next step in the hierarchy is about administrative controls. So this is about providing the right procedures to ensure that we are using non-safe sharps safely. For example, we're not recapping, or if we are, if there is any exception where recapping must happen because of the nature of the procedure, then it has to be done in a safe way. So providing the right procedure. Also in administration controls for sharps, procedures for disposal of sharps and dealing with spillages, for infection control, procedures for responding to sharps injuries, providing speedy access to appropriate prophylaxis, and very, very important, providing information, instruction, and training for the safe use and disposal of devices, as well as making sure that people are aware of the risk assessment and the procedures available to them. And then also suitable reporting arrangements for work-related injuries, included RIDDOs, as we talked about. And then the last part of the hierarchy, which is PPE. And this is always the last option, so you should never try and use PPE as your main protective mechanism. It's your last option, but it can also be used in conjunction with other elements high up in the hierarchy to provide more effective controls when put all together. So that's how we approach assessing and addressing the risks associated with sharps. And so it's important that your risks, this risk assessment and the way that you address risk is documented. And this is called a risk assessment. And why is this important? Well, it's a legal document. We must carry out risk assessment, and it will identify the hazards, including the sharps that you use and whether they are safe or not, why a safer version cannot be used if you have to use a non-safe version, and the risks associated with such devices, and any control measures and particularly procedures. So control measures and procedures, they work hand in hand for the safe use and disposal of all types of sharps, whether they're safe or unsafe. Where is your risk assessment located? A hard copy will be located in your physical departmental health and safety folder. So there's a hard copy folder and a soft copy in your health and safety folder on the shared drive. The former is the one that you would have most access to, and so you need to make sure that you understand where to find it. How will you know about it? Your manager will bring it to your attention at induction, and any updates should be communicated in the most convenient way possible. Example, via email, and or you may be asked to read and sign a hard copy. And if you've never seen your risk assessment, if you didn't see a risk assessment at induction, of course, that second process also applies. So what should you do? If there are no issues, you must comply with the risk assessment and associated procedures. Otherwise, ask yourself the following question: have I seen my sharps risk assessment? Does it tell me what I need to know, including the procedures I need to follow? Is the content clear and easy to follow? And has the assessment been reviewed within the last 12 months? If the answer is no to any of the above, then you need to raise with your manager. So we talked about a hierarchy of control and having arrangements for disposal, and this is part of our control measures. So how do we dispose of sharps safely? So we've got a segregation process. So here we've got, these are the bins that are commonly used in the trust. The purple top is for cytotoxic and cytostatic waste, sharps waste. And then you've got the one that you would most commonly see, which is the yellow top, and that's generally used for any other type of sharps. Now, you may see other colors like orange top as well, and so you just need to make sure that you're clear with why these are used in your areas, and you can get more information from our infection control team. In terms of the sharps bins themselves, it's important that as a trust we are procuring the right standard of bins, and then for yourself, what do you need to do? It must be assembled correctly, including initial labeling, positioned safely away from public areas, particularly out of the reach of children, at a height that enables safe disposal by all members of staff. Be secured to avoid spillages. Be temporarily closed when there's not in use. So sharps bin generally have a temporary close marker, so it tells you where that temporary closure point is. It must not be filled above the fill line. There's also bins generally have a fill line, and so you should not exceed that fill line. Once you reach the fill line, it must be closed, dated, and signed for disposal. Now, you should also not use the bins beyond 3 months once they're assembled, even if you haven't reached the fill line, and that is in accordance with NICE guidelines. So sometimes hopefully you don't come across a sharp spillage, but in the very unlikely event that you have a sharps spillage, you must ensure that you immediately secure the area so that no one else is placed at risk. Inform or ask someone to inform the manager or someone in charge, so that they know what has happened, and that they can stop people from entering the area themselves as well. You need to put on appropriate PPE, generally gloves and aprons, and of course, if there is splash or spillages, goggles may apply as well. Carefully gather up the spilled sharps using a long-handled dustpan and brush, or long-handled forceps, depending on risk. Now, if there's only a few items, a few pieces of sharps, then forceps might might be applicable. If there's a lot, then the other option might be needed. Discard into appropriately color-coded container. If the container is broken, then you need to place into another container to make sure that it is secured. And if there's any bodily fluids involved, then you need to address as per infection control policy for spillages of these sorts of substances. And lastly, it's really important that you report the incident on Datix. There is further information that could be found from infection control, health and safety, or waste management if you're uncertain of what you need to do. But finally, if you sustain a sharp injury as a result of this incident, you also need to report that as well, as per protocol, and of course take the necessary precautions, which we shall now quickly discuss. So if you were to sustain a sharp injury, the actions that you need to take are, you need to bleed it first, so squeeze the wound and encourage bleeding. Wash with liquid soap under warm running water as much as possible. Place a waterproof dressing on and then immediately report to your manager. What's important is responsibility. There's responsibilities for everybody. So we've talked about what you need to do from a first aid perspective. You also need to attend follow-up, which means you go to after the incident, you make sure you attend to occupational health within hours or A&E out of hours. When you get there, what they will do is they will ensure that the risk is assessed and provide you with PEP, post-exposure prophylaxis, if necessary. Managers are responsible for investigating the incident and making sure that necessary steps are taken to remediate. And if it hasn't been reported, because some people might not have access to Datix for whatever reason, they need to make sure that the incident is reported on your behalf if you can't report it. And then finally, health and safety has the responsibilities for reporting RIDDORs if there is a positive blood-borne virus from the source patient. So in terms of RIDDORs, there are two types of incidents that need to be reported under the reporting of injuries, diseases and dangerous occurrences to the health and safety executive. The first type is if any sharp injury sustained, sustained at work from a device known to be contaminated with blood-borne virus, and this is called a dangerous occurrence. And then the next type is if there's a confirmed infection as a result of such an occupational exposure, and this is called an occupational disease. Only the health and safety team is authorized to make a RIDDOR report on behalf of the trust, and it's really, really important that we have information about the incident as soon as possible, particularly if the source patient is positive. We need to have that information because we need to report within 10 days. And so as we focus on reporting and investigating incidents, here is a sample of an incident. And what we can see here is that the law tells us we need to report and we need to investigate so that we can prevent future incidents. This is a typical example of what we would see. So there's no description of the device. So it tells us it's a needle, but we don't know if it's safe or not. We don't know if there are any contributing factors, any risks from the source patient. In this case, we will assume that the person went to A&E first. It was out of hours, but it didn't say what was done in A&E at the time. So in the immediate action section, and then it did say what was done in A&E under the management actions, but what it doesn't tell us here is what were the root causes of the incidences. So what could we have done to prevent it? Were there any issues with procedures, equipment, training, environment, risk assessment is inadequate, and did we address these issues? All of that should be recorded here. And was there any shared learning for the individual and across the department or even the wider trust? So what we've done as a trust is we've developed a pro forma to support the improvement of investigations. And what this does is capture all that information that we talked about in a very succinct way. And so the incident investigator or the incident manager must complete the pro forma and add it to the DATIX incident for closure, because that then tells us a suitable investigation has been completed. And you who sustain the injury must ensure that you must help your manager by providing as much information as possible about your incidences, because in simple terms, improving investigations help us fix problem. So what I'm going to do is I'm just going to play a quick video, play a quick audio for you of a story, and this is a real life incident that led to consequences for the user, and it just brings it all together, the importance of safety devices and the importance of why we must report incidents. So if I can just play and you listen. This is the story from Karen.
Hello, my name is Karen Daly. Nearly every healthcare worker has a story about a needle stick or a near miss. Even the most experienced nurses and practitioners working long hours with no margin of error will experience that sinking feeling of dread when a sharp end of a used needle accidentally punctures their skin. My own story is from the summer of 1998 when I was working in the ER as a nurse at the Brigham and Women's Hospital in Boston. Asked by a colleague to perform a blood draw on a patient with difficult venous access, I was able to accomplish the task in my first attempt. Unfortunately, when I went to dispose of the blood draw needle in the biohazard container behind me, I was stuck by another disposed needle poking out from the overfilled box. Like many nurses, I've been stuck before, maybe 6 or 7 times, and only reported about half of them. In this case, I did decide to report my injury, but only at the insistence of an ER colleague who witnessed it occur. Thank goodness I did, because it wasn't long before I began having some unusual symptoms that concerned both me and my doctor. 5 months later, I was diagnosed with hepatitis C and HIV as a result of that same inadvertent needle stick. In 1998, this meant a frightening and potentially life-threatening road ahead with long, intensive, and difficult treatment regimens. I was not alone in the circumstances surrounding my needle stick injury. More than 2 million infectious needle sticks are sustained by healthcare workers across the globe each year, according to the World Health Organization. And more than 1.3 million people die annually as a result of unsafe injection practices. My ask of you, embrace safety technology to protect yourself. Push yourself and others to practice safely. And if you or a colleague do get injured, report it. Thank you.
So where can I find more information about SHARPS? Well, the Trust has several policies. We've got our SHARPS policy. We've got our infection control policy. We've got the control of substances hazardous to health, COSH policy, our waste management policy, and of course, our health and safety policy. These can all be found on the Trust intranet under Publications, Trust Policy, DIMS. Further information can also be found on the HSE website. Thank you very much for listening. Now, you must complete an assessment of learning to ensure that you complete this training. Thank you.